Good morning, everyone. I'm going to present paper on long-term post-penetrating keratoplasty result with or without proper processing of donor tissue. So coming to the introduction, so corneal blindness is one of the most challenging public health problem all over the world, and is so much so true for developing country like India. And penetrating keratoplasty is one of the way of combating it, where the full thickness diseased cornea is replaced by full thickness normal healthy cornea. So successful outcome of penetrating keratoplasty will depends on various factors like donor and host factor, surgical technique, as well as post-operative care. But it is very much necessary to identify the complications as early as possible and to manage it accordingly. Our aim is to study the visual outcome in patients undergoing penetrating keratoplasty in tertiary care center of Northeast India, and to compare the long-term surgical outcome in patients following penetrating keratoplasty with and without processing and evaluation of donor tissue in tertiary care center of Northeast India. So all the patients registered in and who were in the waiting list for optical penetrating keratoplasty were with the following corneal pathologies like leukomatous corneal opacity, entestaphylloma, bullous keratopathy, corneal perforation, keratoconus, and graft failure were included in the study, and patients with posterior segment abnormality and those undergoing therapeutic and cosmetic penetrating keratoplasty were excluded from our study. This is a hospital-based case control study which was conducted in Northeast India, which included patients with corneal pathologies fulfilling all the inclusion-exclusion criteria and who have undergone optical penetrating keratoplasty performed by a single surgeon. So there were two groups, group A, which consisted of 8 patients who underwent optical penetrating keratoplasty with grade 1 donor cornea, which were evaluated after with slit lamp and specular microscopy. They were taken as the targeted sample and were followed up for 1 year post-operatively. And this was compared with group B, a control group of 16 patients who underwent keratoplasty using donor cornea, which were examined under only slit lamp because there was no availability of a specular microscope during that time. Ethical clearance was obtained from Institutional Ethical Committee, and informed consent of the patients were taken for each of the cases. So coming to the result, the collected data were observed through a master chart and results were statistically analyzed. In the study, mean age of the patient belonging to the group A were 37 plus minus 2 years, whereas it was found to be 42 plus minus 2 years in group B. When we saw after 1 month post-operatively the best corrected visual acuity in group A, we found that one patient accounting for 12.5% had visual acuity of more than 618, whereas in group B only 6.25% had visual acuity of more than 618. In group A, 6 patients had visual acuity of less than finger counting at 6 meter due to microcystic edema and ciliary congestion, mainly suggesting early graft rejection, whereas in group B, it was found that 4 patients had visual acuity of hand movement and 1 patient had only perception of life due to graft failure. At 12 months of follow-up, we found that in group A, 4 patients accounting for 50% had visual acuity of more than 618, whereas in group B, we found that 2 patients accounting for 12.5% had visual acuity of 618. In group A, we found that at the end of the 1 year, we found that the visual acuity of finger counting at 2 meter, where only 1 patient had that vision, whereas in group B, we found that 4 patients had visual acuity of on perception of light and 2 patients had visual acuity of hand movement. Coming to the post-keratoplasty complications, in group A, 1 patient had loose suture which required resuturing, whereas in group B, 4 patients had loose suture. In group A, 2 patients had post-operative uveitis, which also got resolved within 1 week following the use of topical steroid. 2 patients had elevation of intraocular pressure, which was well controlled with the use of topical anti-glaucoma drug as well as oral acetazolamide. And 1 patient had corneal vascularization and 1 patient with mild corneal stromal edema. Whereas in group B, we found that 2 cases had corneal vascularization and 2 patients had signs of endothelial rejection, 4 patients with graft failure. The two-sided p-value was found to be 0.03%, which was clinically significant. This is the picture showing the preoperative and the postoperative of penetrating keratoplasty in case of leukomatous corneal opacity in group A. This is picture showing in group B. So coming to the discussion, the mean age was found in group E was found to be 37 plus minus 2 years in group A, whereas it was found to be 42 plus minus 2 years in group B. The mean BCVA at the end of 12 months was found to be better in group A than to be in group B. The postoperative complication was also found to be less in group A than in group B. Coming to the conclusion, corneal tissue processing and evaluation using proper slit lamp evaluation and specular microscopy along with grading of donor corneal tissue plays a very important role, resulting in better visual prognosis as it gives proper recipient selection and healthy donor tissue for optical penetrating keratoplasty. Good corneal donor tissue selection provides better visual acuity, less graft infection and less graft rejection leading to successful penetrating keratoplasty.